Have you ever felt like your child might be just a little different, but you couldn't quite put your finger on why? And what if those differences, if seen, could actually unlock understanding, better support, and relief for your entire family? Well, today I'm going to go into 5 early signs that your child might be showing traits of autism and why catching that early can make all the difference. Hi there. I'm Dr. James Thatcher, and I specialize in giving comprehensive autism assessments. And I've been working with children, teens, and families for about 20 years now in providing these assessments. In fact, I've done over 2,000 of them. And I've seen a number of individuals and patients that are neurodiverse. And one question that I keep getting asked over and over again, especially by parents, is, could my child be autistic? So today, I'm going to go into 5 early signs that may indicate that your child is on the autism spectrum. And these are things that I've seen in my practice over and over again. The first sign I see is social differences. So what you may find in your child is difficulty making eye contact. They may avoid eye contact. They may not answer to their name, or they may seem uninterested in playing with other children. Many parents may see this as their child being shy, but it could also be their child having social communication difficulties that are a part of autism. Sign number 2 is repetitive behaviors. So this may look like your child lining things up, or flapping their hands, or saying certain lines or phrases from movies, other known as echolalia. And these behaviors can come off as quirky or even very cute, but they could also be ways that your child is self-soothing and or trying to just make sense of the world. 3 is intense interest. So does your child have a deep and intense interest in different topics such as trains or dinosaurs, space, or even vacuum cleaners? And these are just several examples. It could really be anything. What to look for is, are they learning a lot of information about it? Is it hard for them to transition away from it? Is it hard to get them off of this topic? And even though this comes off as a fixation, this is actually a superpower to where they're able to deeply focus and master this information. 4 is sensory sensitivities. You might notice your child covering their ears when in crowded environments or when a loud noise occurs, or they may have difficulties wearing certain clothing textures, or they may be sensitive to light or touch. And these issues indicate that there's a sensory processing disorder going on. And this is very common in neurodiverse individuals. So number 5 is difficulties with transitions. Does your child have a meltdown whenever there's a change to a plan or whenever they need to transition from one activity to another? And these difficulties with transitions or having a rigidity in their routines could be a sign that they're on the autism spectrum. If you've recognized one or more of these different signs, you're not alone. What I would encourage you to do is to seek out a qualified specialist that can evaluate to see if your child is on the autism spectrum, but not just to look at autism symptoms, but to look at everything else. So all of these different signs that I've talked about today could be that your child is on the autism spectrum, or it could be that they have anxiety. A child is going to avoid eye contact if they're anxious. It could be symptoms of ADHD. Sensory sensitivities are also very common in kids with ADHD. That's a different sort of neurological disorder. They could have difficulties in rigidities, or they could have difficulties in transitions. And again, that could be a sign of not autism, but anxiety. So finding a qualified mental health specialist that has a lot of experience in evaluating for not just autism, but a range of different things is going to be essential. And at Forest Psychological Clinic, we provide comprehensive autism testing to children, teens, and adults, all the way from 18 months all the way up to 80 years of age. As an evaluator, I don't want to just say yes or no on autism. At the end of the day, what I want to do is I want to say, yes, they are on the autism spectrum, and there's these other issues too. Or to be able to say, no, it's not autism, it's this instead, and here's why. And that's why we do comprehensive autism testing. That way we can look at everything and get a full picture. So if you're interested in getting a comprehensive evaluation, please reach out to us. I'll put a link down below to our website so you can get a little bit more information, and feel free to give us a call and get a free consultation. All right, take care, and I'll see you in the next video. Bye-bye.